I went into nursing as a second career, actually. My first career was in business, and I was kind of dissatisfied with simply helping people make money and improve their financial status. I was in the finance world, and so I wanted to find a way to help people in a more sincere and helpful way. I came across a woman I met once who was going back to school to be a physician's assistant, and we spent a whole weekend with friends talking about her career, and it just made me feel that I wasn't doing what I needed to do for my career and my life. So I went back to school. I tested the waters with a couple classes, fell in love with nursing classes, sciences, and I, at 27, went back full-time to be a nurse. I've never worked as a nurse in a pandemic before, so it's been incredibly overwhelming and incredibly interesting to see how the world works in that kind of a situation. I think I've started to feel this camaraderie with the rest of the nurses in the world. You turn the TV on every day and you see nurses stepping up to the plate and taking care of patients when it's not an easy thing to do, and this environment's hard, the wearing all the gowns and the masks are hard, but you feel so almost proud of yourself for being that person that can do it, and if you can do it, you should do it. So many people are coming to us with saying we're heroes and putting signs on my yard and saying, thank you for everything you do, and it makes you feel so good and appreciated, but in a humble way, I guess. So I've always had an appreciation for end-of-life nursing. I had a case of a patient who was not going to do well. The intention was for him to die with us because he was so sick, and his wife would call and she'd be crying and so sad and just wanted to connect with him, and so I'd take the phone and put it right to his ear, and it calmed him down when he was at a time where he was struggling to breathe and in pain and very restless and anxious, how he just settled right down. And for me to be able to tell his wife that you've made a difference just talking to him made her feel like she was able to help him at the end of his life when she couldn't otherwise be there. And it was very precious, and she was crying and I was crying, and ultimately the patient suffered maybe a smidge less because he was able to talk to his wife or hear his wife's voice at the end of his life, and it was sweet, and he died shortly thereafter. But it was special, I think, and it's always an honor and a privilege to be with the patient at the end of their life. Usually it's so nice when the families are surrounding the patient, but when they can't physically be there, then we try to find other ways to help connect them at the end.